political reporter for The Washington Post and an MSNBC political analyst, Robert Costa. He's the moderator of Washington Week on PBS and national security correspondent for The Washington Post, Greg Miller. He co-wrote the extensive piece for The Washington Post that details the failures of the Trump administration's response to the COVID-19 pandemic. Really spells it out. Quote, by the time Donald Trump proclaimed himself a wartime president and the coronavirus the enemy, the United States was already on course to see more of its people die than in the wars of Korea, Vietnam, Afghanistan, and Iraq combined. That is from the lead story in yesterday's Washington Post. On Sunday, the paper published the results of a month-long investigation, a definitive account of the government failures to properly anticipate and respond to the coronavirus crisis. The report retraces the failures of the first 70 days of the outbreak. Quote, from that initial notification for President Trump to treat the coronavirus not as a distant threat or harmless flu strain well under control, but as a lethal force that had outflanked America's defenses and was poised to kill tens of thousands of citizens. That more than 2-month stretch now stands as critical time that was squandered. Here's the timeline. We start on December 31st. The CDC learns of a cluster of cases in China and begins developing reports for the Department of Health and Human Services. January 3rd, China tells the CDC of the outbreak. HHS Secretary Alex Azar is informed, who in turn informs the White House and the National Security Council. A few days later, U.S. spy agencies warned Trump of the outbreak in the president's daily briefing. January 8th, the CDC issues a public warning about COVID-19. January 18th, Azar finally gets to talk to Trump about COVID-19, but Trump wants to berate him instead over his agency's attempts to limit vaping. The president dismisses Azar as alarmist. The HHS secretary is so worried that he asks associate advice on how to get Trump to listen to the warnings. January 21st, a Seattle man becomes the first American to contract the virus. January 22nd, Trump is asked by a reporter in Davos if he is worried about COVID-19.
It's one person coming in from China, and we have it under control. It's going to be just fine.
January 24th, China blocks a U.S. lab from getting a virus sample to study 1 day after shutting down the city of Wuhan. Trump, in turn, lavishes praise on the Chinese president. January 31st, Azar follows China's lead by banning most non-U.S. citizens from traveling from China to the U.S. NSC and U.S. health officials push for a Europe travel ban, but President Trump and Treasury Secretary Steve Mnuchin refuse, saying it will hurt the economy. February 6th, the WHO announces the shipping of 250,000 testing kits for COVID-19 around the world. The CDC only has 90 to send to a few state health departments. Those tests prove faulty, setting the program back. February 10th, Trump addresses the virus at a rally in New Hampshire.
And by the way, the virus, they're working hard. Looks like by April, in theory, when it gets a little warmer, it miraculously goes away. I hope that's true. But we're doing great in our country, China.
February 26th, Trump again takes on the future of the virus.
When you have 15 people, and the 15 within a couple of days is going to be down to close to zero.
February 29th, the Washington state man became the first American to die of a coronavirus infection. That same day, after a month of CDC failures, the FDA approves private testing for COVID-19. March 6th, Trump, donning a campaign hat, visits the CDC in Atlanta.
Anybody right now and yesterday, anybody that needs a test gets a test. They're there. They have the tests. And the tests are beautiful. Anybody that needs a test gets a test. And I like this stuff. My uncle was a great person. He was at MIT. He taught at MIT for, I think, like a record number of years. He was a great super genius. Dr. John Trump. I like this stuff. I really get it. People are surprised that I understand it. Every one of these doctors said, how do you know so much about this? Maybe I have a natural ability. Maybe I should have done that instead of running for president.
Yeah, no, not at all. You know, March 6th, Mika, again, he says that the tests, they're there now. Anyone who wants to test can get it now. That was on March the 6th. Chances are very good. If you want the test now as an American, you can't get it.
Yeah, that was not true. March 9th, the president mocks state lockdown orders, tweeting the common flu kills thousands a year and nothing is shut down. Life in the economy go on. It will just go away. Just stay calm. March 11th, Trump finally shuts down travel from Europe several weeks after the NSA and health officials required that he do so. March 31st, at a news conference, the president finally succumbs to the coronavirus reality, announcing it is absolutely critical for the American people to follow the guidelines for the next 30 days.
It's a matter of life and death, frankly. It's a matter of life and death. I know our citizens will rise to the occasion, and they already have sacrificed a lot.
He had actually called it a hoax before then.
Called the press coverage a hoax, saying that they were exaggerating.
The Post concludes the United States will likely go down as the country that was supposedly best prepared to fight a pandemic, but ended up catastrophically overmatched. It did not have to happen this way. Though not perfectly prepared, the United States had more expertise, resources, plans, and epidemiological experience than dozens of countries that ultimately fared far better in fending off the virus. It may never be known how many thousands of deaths or millions of infections might have been prevented with a response that was more coherent, urgent, and effective.
Let's bring in Greg Miller. He was a co-author. Greg, the thing that I think will strike most Americans who are still hearing the president in denial into March is what happened, how early all the warnings came the president's way and everybody's way in the White House. Even last year, December 31st of last year, the CDC begins developing the reports for HHS after getting the information about the virus. On January the 3rd, formal notification came from China. A few days later, early January, U.S. spy agencies began warning the president of the outbreak in the president's daily brief. On January the 3rd, the CDC chief relayed the disturbing news to HHS Secretary Azar. On January the 3rd, Azar shared that Chinese virus information with the White House and the NSA. On the 6th, the CDC offered assistance to China. That same week, the HHS convened an interagency task force on COVID-19 with HHS's Azar, the CDC head, and Dr. Fauci. On the 8th, the CDC issued a public warning about COVID-19. All of that, that's all within basically the first week of January.
Right. And it's so important to, I mean, the purpose of this story was to look at that timeline because so much of it was squandered. I mean, preparing for the outbreak of a novel virus like the coronavirus, experts and professionals will tell you requires sort of worst case scenario thinking from the very beginning. It requires taking preparations that ultimately might not be necessary and that you hope will not be necessary, but that you won't have time to take care of later. And that's sort of what we are facing in the United States now. These delays set back the development of testing, which contributed heavily to the inability to track the outbreaks in places like Seattle, Los Angeles, and of course New York. It contributed to the inability of the government to procure badly needed supplies that are now in acute shortages at hospitals dealing with this outbreak. And you have to look back at that first month and even that second month as extremely costly for U.S. citizens.
Jonathan Lemire.
Greg, Greg, it's Jonathan Lemire. Terrific piece. Thank you for walking us through it. I wanted to zero in on that idea. You just started touching about it on testing. It seems like that's the biggest difference between the countries that have been able to respond to this effectively and those that have not. And the U.S., sadly, is in the latter category. Walk us through. Take us into a little more detail about some of the steps that were missed instead of producing widespread tests, the lack of urgency at the White House to mobilize the private sector to help create the one thing that would, as you just said, would allow the nation to effectively track what's going on and perhaps potentially stop this spread.
Yeah, because interrupting, slowing the spread of a virus like this really comes down to your ability to figure out who has it and who doesn't and separate those people as quickly as you can. So if you don't have a test, you don't have that visibility into the spread of the virus. And that was a critical issue in this case. And the breakdown came for many reasons. I mean, one of the first was that China itself refused for a while to provide samples of the virus. And so that was a setback for U.S. researchers and scientists. But it also, that was just the earliest of a series of cascading failures, which also, I think, when we spoke to U.S. officials in the administration, in the CDC and elsewhere, acknowledged that there was some institutional hubris here, that the CDC for many years has taken the lead on developing tests for new outbreaks like this and felt certain that this was just one of those cases. They would take care of it, no need to enlist the dozens and dozens of private laboratories that the United States has that are also able to develop tests like this. And so when the CDC test failed, and this was critical, they send samples out. They think they're ready to go, and these labs start using them around the country. They realize almost immediately that they're giving bad results. They're not reliable. And then you're back to square one. And so that's a critical squandered period of time.
And there's a date here, February 27th. FDA official lashes out the CDC saying that if they were a private business, quote, I would shut you down. One failure after another. The BBC's Katty Kay's with us. She has the next question. Katty.
Greg, it's really striking reading your report yesterday and then listening to the White House briefing and how often we heard the president and the vice president say what a fantastic job the administration is doing. Is there anyone in the administration, according to your reporting, who would recognize your timetable and admit that there were moments where, for example, with the tests that went wrong, things that went wrong, or that the tests that they said promised were going to get out didn't get out, or the lockdowns that they said were going to happen didn't happen on time? I mean, how much recognition and acceptance of responsibility is there anywhere in the administration that this has been a catalogue of missteps?
Well, of course, in this administration, it's highly perilous for anybody to contradict the president. I mean, you don't last very long if you're not on the same page with the president, or you undercut what he's saying. In this case, though, I mean, we were able to identify important individuals very high up in the administration who were on the case from very early on. Matt Pottinger is the Deputy National Security Advisor, and by January, he was urging mobilization. In February, he is urging the shutdown of flights coming from Europe, where the outbreak had already spread from China. So the Trump administration blocks flights from China pretty early on, but allows flights to continue into the United States for weeks from Europe after the outbreak is already there. And Pottinger's guidance or advice goes ignored for a month or so, in part because of his voice is drowned out by those who were guarding the economy and the stock market, including the chief of staff at the time, Mulvaney. So there were these frictions and battles inside the administration. What do we care about more? Preventing this virus from spreading in the United States, or preventing the stock market from plunging?
All right, Greg Miller, thank you so much for being with us, and thank you and your colleagues for great reporting, an important story in yesterday's Washington Post. We'll be talking to you soon. Thanks for checking out MSNBC on YouTube, and make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.